Hello, everyone. Welcome to NYC Builds Bio first sponsored seminar series with SGA in collaboration with Genetic Engineering and Biotechnology News. SGA is an architecture, interior design, planning, and construction firm founded in 1991. With over 70 people in Boston and New York City, SGA pioneers tech-forward design that redefines how projects are visualized and delivered, including innovative life science projects. SGA's team-first approach and trademark creativity has resulted in over 300 million square feet of successful innovative commissions. This webinar is entitled Life Science Facility Planning Post-COVID-19. Thanks so much for joining us this afternoon. My name is Nancy Kelly, and I serve on the steering committee and as a founding member of NYC Builds Bio. I want to thank SGA for sponsoring this webinar and Kevin Davies, executive editor at GEN, for collaborating on this series. I would also like to acknowledge the founding and corporate members of NYC Builds Bio who make this programming possible. This is the last of 4 virtual events hosted by NYC Builds Bio this month. If you weren't able to attend, be sure to check out these programs on the NYC Builds Bio website. In early May, we hosted our first virtual quarterly breakfast, attended by over 100 registrants, entitled Uncharted Waters, which focused on the heroic efforts made by companies, institutions, and many of our members to produce and expand the testing capacity, personal protective equipment, and facilities needed to care for New York City patients during the recent COVID-19 crisis. You can access that event presentation and recording on the events page on the website. On May 19th, in collaboration with Genetic Engineering and Biotechnology News, we hosted a virtual webinar entitled Vanquishing the Virus, attended by nearly 200 registrants, which examined the top COVID-19 drug and vaccine candidates currently under development. Executives from 3 New York companies, Regeneron Pharmaceuticals, Mount Sinai Innovation Partners, and Tonix Pharmaceuticals, joined us and told us about the efforts they are making to vanquish the virus. On May 21st, in collaboration with BioCentury, we hosted a networking reception for current and prospective members, which included a discussion surrounding the business and financial impact of COVID-19 on the life sciences industry and healthy building employee strategies for returning to work. Bill Harvey of Newmart Knight Frank also gave a virtual tour of InnoLabs, Long Island City King Street Properties, which is currently under construction. Over 200 people registered for that, and we enjoyed time for member breakouts at the end of the call. We're currently planning the online programming for June, so be sure to check out the website for those events. The program today focuses on the unique strengths of our life science industry and research universities that has allowed the United States and New York City to build the strongest innovation engine for science and medicine. One of those unique strengths was the programmatic placemaking that drove the conceptual development of life science parks, facilities, accelerators, and laboratories. In these places, scientists and doctors came together to collaborate on new discoveries and innovation. Today, like many office tenants and other urban occupiers, the life science sector is reacting in real time to the COVID-19 outbreak. The term life sciences often brings images of lab space to mind, but that is not always the case. Many life science campuses in urban centers have as much office, training, meeting, and amenity space as they have lab space. As the nation's most influential life science clusters compete to attract top talent and researchers to their campuses, this webinar will examine how experts predict the design and development of leading life science facilities will evolve in the wake of the pandemic. How will the effect of COVID-19 on return to work affect scientific creativity? How will this affect the startup community's ecosystem? Our discussion will focus on laboratory design, infrastructure, equipment and technology, as well as the process of returning to work. We will also look at the important cultural change that may be required. We will hear from 4 experts in the field: Jeff Tompkins, founding partner from SGA, Anthony Montalto, associate partner, JBB, Robert Mitchell, principal and owner, Mitchell Associates Architects, and Jim Holland, managing director of professional services for Triumvirate Environmental. Before I begin, let me cover a few administrative details. There's a program highlighting the hosts and speakers for the meeting. These will be posted on the NYC Builds Bio website after the meeting. The program's also being recorded and will be available on the website and our YouTube channel after the meeting. If anyone's having technical difficulties accessing the Zoom room or other issues, please email info@nycbuildsbio.org or send a notice through the chat button at the bottom of your screen. Since many of you are participating in listen-in only mode, please feel free to submit your questions via the Q&A button on the bottom of your screen. We will open up for discussion and Q&A at the end of the program and will address as many of your questions as possible. So let's begin. I'd like to begin our discussion today by asking what we've learned from companies who have previously tried remote working strategies and have learned that working remotely from home is not the answer for innovation. Jeff, can you tell us about Sun Microsystems and their experience with decentralized locations?
Sure. Right around the time that Oracle was looking to purchase Sun Microsystems, we were doing quite a bit of work for them in their Burlington campus, and they were in the process of divesting themselves of retail real estate that they bought in Southern California that was utilized by folks that were working from home to be able to touch base and have some technology available to them that they might not have in their house. So this was right at the beginning of the work from home concept. And what they found was that these spaces didn't work very well at all. People would go there, they didn't interact with anybody else that was there. They'd go there, they'd get whatever they needed from that location, they'd go back home. And then after a period of time, they started to go back to the HR group and said, we don't want to work from home. Even though traffic is an issue and you've made your standard workplaces smaller to let us work from home, we'd rather have the space in the traditional office. We'd rather go there, even if we had to go there 4 days a week or 5 days a week, because we missed that interaction. They were seeing people leaving the organization. They were seeing increased issues with depression. These are studies that have been backed up in a number of cases. But people wanted that human interaction. They wanted to feel as they were part of a team. It's not that they couldn't do their work from home. That wasn't the issue. The issue was they wanted to be able to turn to a person and say, hey, I was just thinking of this. What do you think? They needed that sort of anecdotal opinion, or what I call water cooler talk that creates big ideas, things that you might never have said. You're sitting at home thinking about something. It's maybe not even something you're working on. It's just this idea, and you pass somebody going to get a cup of coffee, and it turns into a new business. That's not going to happen when you're sitting at home, on Zoom calls all day long. I know personally, for me, I can get my work done from home. My staff can get their work done from home, but I actually found myself spending twice as much time doing my work because I'm on a Zoom call for an hour, and then I need another hour to go do what I'm supposed to do to get off the Zoom call. And so now instead of working, 10 hours a day, I'm working 20 hours a day. And that, that's an increasingly stressful situation that isn't necessarily advancing a project or advancing an idea.
Yeah, and that bump in collaboration is especially important for life science facilities, where you can just stop and draw on the walls when you have an idea and somebody can come by and start drawing with you, right?
I would say we had a project, and one of the best things that we had at this project, where there were a company that was moving out of a location, and they were very worried about it. We encouraged them in their open space to put up a huge whiteboard and just let everybody write whatever they thought about relocating on this whiteboard. and we would go in once a week, take a picture of it, and write it down in notes. It was the best programmatic information we ever got on a project. It was
Wow.
just, somebody wrote something, somebody replied to it, somebody responded. It was excellent. So it was just proof that that interaction is important.
Yeah. Jim, what did IBM learn from its massive hoteling areas?
Sure. Back in the 90s, as IBM pushed into more services and not just hardware and software, they tried to create these areas where people could come in, log into a cube, a hoteling space not run. We're all familiar with them. But at the same time, they were finding out with the idea that there'd be collaboration between a software person and a hardware and services group. But they were so big and they were so massive, people would just naturally, as Jeff indicated, come in, use the internet connection, and then go back home and do whatever they had to do, or trust their own home internet connection. It got to the point where IBM started to stand for "I'm by myself." So that became the running joke for a long time. They've eliminated a lot of those big places and gone back to more structured, intimate meeting areas. I think that is ideally going to make people feel like they want to come into the office.
Yeah. And Anthony, what did Google learn really drives innovation?
Sure. A few weeks back, we know Google made the announcement they wouldn't need as much office space moving forward with their workforce. They're going to be moving more towards a remote work environment. And I spoke to one of the employees, and they weren't totally in line with that sentiment. Part of the reason they joined that organization was for the collaboration, the random interactions, and of course, their amenities, which they're famous for, the food service, the gaming areas. So they want to get back to those type of environments again. They miss those. So I think we need to, continue to further develop, some sort of building engineered enhancements to really reduce the risks that we're faced as we get back to these workplaces, and look at more of these regimented protocols, when we start to look at, reoccupying these workplaces.
Yeah, so thinking about laboratory design and infrastructure and equipment and technology, how do we utilize those things to return to work knowing that it's not zero risk right now? Robert, you want to lead us off?
I'm in, just a quick one on that. Need a quick correction. Firm is the Mitchell Architectural Group.
Oh, I'm sorry.
It's not your fault. Adam did it to you. He never corrected it. Blame Adam. We're in Connecticut. We only do, advanced technology, clean environments, things like that. So it's good. Yeah, we've talked to several of our pharma clients over the last 6 to 8 weeks about their groups coming back. And they're looking at now multidisciplinary lab designs, whereas previously everything was a specific protocol in this lab. Well, that's now beginning to hurt them. And they've had to go to multiple shifts in labs because they have fewer people coming in. So how do we handle that as we're going in? So we're looking at much more flexible generic laboratories as we design, but the impact right now is changing equipment out from a laboratory to something else. The impact is on HVAC systems, electrical systems along those lines. And the niceties we had before, where you came out of your lab, there was a nice living room, that's now gone. And we're trying to keep those researches. It's very difficult to do research from home, but we're finding that they're going back to, well, our vivarium is in Chicago. With AI and the other computers, we can work anywhere in the country. So they're evolving actually how they're doing their genomics research, other research, so that they can do it more remotely if they have to. Very interesting conversations going on about how do we stay ahead of the curve when we don't know where the curve is going.
Yeah, so do you think that this will drive more automation, like the automated laboratories like Transcriptics and Emerald Cloud Laboratories?
Much more automated, much more equipment, much more robotics going in, than we saw before. It was always discussed, but it was never a driver. Now all of these other items are becoming drivers on that, where you can go into a lab, pull out a major piece of equipment, put in another major piece of equipment. Now, instead of being a testing lab, they're doing vaccine filling in that one, just by making certain changes, going from a standard safe lab to a critical safe lab. Being able to do that, again, a lot of HVAC impact, which wasn't built into the buildings to start with. It's now, how do we do this? So a lot of that going on. So I think what we're seeing is how can we avoid the problems we're having now, where we've got a client, we've got researchers, and they can only work in that one lab. We change something's going on, how do we get other labs to be very, very flexible? As we were talking earlier, not to berate the architecture, but the only real difference between a chemistry lab and a biology lab is the equipment and the type of hoods. Architecturally, from a plan, they look the same. That's a big impact on HVAC and electric. And we're finding that the architects, HVAC, electric, the consulting engineers, and the building management owners, as well as their facilities, are discussing very early on all these future requirements, which we didn't do before.
Yeah, so Anthony, are you seeing that?
Yeah, we are. I think the key piece is that there are things we can start doing now to get people to reoccupy the labs. In the future, of course, when we get to automation, that's going to help reduce the risk of virus mitigation. But I think we got to start to understand, the various forms of transmit within a space. And we're still trying to get to the bottom of that. Even with CDC, they haven't defined how the virus is truly being transmitted. But to date, we know large droplets from coughing, sneezing, right? Aerosolized, being mixed around our circulation of our buildings, and potentially the viruses being on our surfaces, our work surfaces, and various other surfaces in our spaces. So there are things we could do to actually start to reduce those risks. One of the things I think we'll start to look at more so in the future is how air is actually supplied to a lab space and how it's pulled out. Really trying to minimize how much air is being recirculated in a space itself. I think we'll be more critical understanding the airflow patterns, and we can use modeling with CFD software to understand the patterns. And the key with that really is we're going to take a chapter from the book of good hospital design. Maybe we're looking at supplying high over the lab benches, right over the occupants, giving them clean, fresh air, and then pulling all those contaminants down low through a low register within the space. So there are things like that we can start to absolutely look at. The thing we should definitely caution from is kind of introducing active agents within a supply air stream. There are agents that can come into contact and desanitize the space. We want to be careful that we're not mixing that with what's going on within the actual chemistry of the space. So I think we have to look at more different types of design elements instead of just implementing desanitizing elements within the airstream. So there's a multitude of things we can do in the future, and we absolutely should be looking at in terms of reducing that risk of recirculating those pathogens throughout the space.
So the design solutions are more long-term though, right?
There are some that are long-term for sure. Modifying, where you're delivering air to space is absolutely long-term. But there are things right now we could do. Is there extra capacity to just bring more ventilation air to a space? That's a simple thing to do. And a lot of the good facilities have that extra capacity, for flexibility purposes. So those kind of things with just diluting the amount of particles in the airstream are really critical, like day one when we start to reoccupy the labs.
Yeah.
This is Bob again. One of the things we're seeing, actually a question that came up yesterday, was we are changing this laboratory from A to B. And I think am I still on? Changing this lab from type A to type B. Can we get chlordisis or hydrogen peroxide in here and fog the room to make it a clean room? And by making it a clean room, we can use it for something else. They weren't originally designed for that. We have to seal the room in order to fog it. And that affects HVAC and other things. If it's a vivarium, they're designed to do that, but labs haven't been before. And it's going to be happening. Just as Anthony was saying, we have to provide a clean space. This must be a clean room because we're changing a protocol going on in it. We're going from standard safe to critical safe. And we have to be able to say there was no contamination in that room.
Yeah. So Jeff, going back to your original point about collaboration, what do you think is going to happen to breakout rooms in the collaborative spaces that scientists enjoy today?
Yeah, I think the biggest issue for a lot of our clients isn't necessarily the lab space, coming back to work in the lab space. It's coming back to work in the office space. Yeah. Their lab spaces are, people that are using those spaces are familiar with how to use PPE. There've been safety practices. Not everybody in a life science company is even allowed into the lab. So there's, they already have pretty tight controls and procedures. So it's going to be really more about how do I collaborate? So we're we're promoting, some pretty simple practices. First of all, look at your conference spaces and, either don't populate them at all or depopulate them. Maybe look at less enclosed space, so 3-sided spaces, where you could put whiteboards on 3 sides and have 2 or 3 people standing within 6 feet of each other, and being able to write back and forth. And as long as everybody's wearing their appropriate PPE, cleaning their hands, not sharing things like markers and erasers and stuff, you could do that. And I think that's what we're going to see. I mean, I spent the morning with a client actually working that out on a plan of space that they're going to try to reoccupy, changing workstation sizes, alternating where people sit, taking larger spaces or spaces that they had for expansion and moving people into that now so that they could lessen the amount of people in other spaces. I think it's all possible. It's all positive, and we'll get there. But I also see that as we design new spaces, we're going to start to have more conversations about airflow. It's a pretty simple idea, right? If I have more fresh air, then I have less contaminant. And it's not that hard as a concept to say, if I can bring clean air into a space and I have less dirty air in that space, it's not hard. So we're going to do more and more of that. But in the interim, I think we're going to see people changing how they utilize their space. So small rooms, probably not going to be used at all. Bigger rooms that were boardrooms might end up being 4-person conference rooms. And I can sit at, we can sit at all 4 sides of the table and be 8 or 9 or 10 feet away from each other.
Yeah. So Jim, what about the process of returning to work? What kinds of things do we need to be thinking about as employees are invited back?
Sure, thank you, Nancy. I think that a lot of the things that we're seeing out there already are happening, things like temperature screenings, traffic management, and that's universal. That's not just in the lab. We think that you're going to start to see a lot more of, as Bob indicated, automation, including delivery of, materials to the lab, people's, lunches, where can we find contactless devices around copiers and in the lab instrumentation. The fact is, I think people are going to look at this as an opportunity to, substitute capital for labor. How can I reduce the number of people in my lab or office space, and then be able to reduce the number of infection points and then possible transmission modes. So we're seeing a lot of people maybe being repurposed. Like, okay, instead of having one role in an organization, I'm going to have 2 or 3. That again allows me to reduce the number of headcount in an operating space. There was a big push for what's called automatic guided vehicles, AGVs, a while back, but they were a nightmare to maintain. You can start to see those as being coming back into the workspace as a way to move materials safely. How they can enter in BSL1s and BSL2s. They'll take some modification to the labs. They can be sanitized easier than a human being, obviously, and then safely. We've talked a lot, I think there's going to be a much bigger role for the human resources group. You're going to start asking people to share more information about their health, maybe doing monitoring at home even before they come into the office. More and more of our clients are asking for support to have an occupational health person and creating that space to screen employees as they come in. We just got a request from one of the major museums here in New York. How could they do employee and potential patron screening for everyone coming in and out of the building? So, I mean, people are thinking about this long. I think the good news is some of the process stuff is an easier fix than the long-term infrastructure things. But the number of pieces are moving in there. And I think, even as safety ambassadors, we heard from the construction folks last week that more and more people are out there just managing safety and helping them go forward.
Yeah. So that kind of brings us to our third major topic, which is, this whole idea of culture and trust and personal responsibility. Someone said last week in one of the events that we had, now everyone in the pool is a lifeguard, right? You've all got to be looking out for each other. So cultural change will be required. Kevin, do you want to pick up that discussion?
Absolutely. Yes. Thank you very much, Nancy. I'm Kevin Davis with Genetic Engineering and Biotechnology News, which has been covering the biotech and pharma life sciences sector for almost 40 years. Before I lob a few questions to our panel, just a quick note to the audience. We have a live Q&A discussion period at the end of our structured discussions. So you see a Q&A button. Please, if you have a question for any of our panelists, take advantage, and we'll try to get to those questions in the closing minutes of the webcast. Yeah, we did want to change and transition a little bit to some of the more cultural and personal responsibility issues, and you've already just touched on a few of these. I think the first question on my mind is, how do we create interactive spaces when employees can't interact in person? Jim, maybe I'll start with you. How about that?
Well, I think we've all agreed that we're all tired of Zoom, and we're all tired of GoToMeeting and things like that. You know,
You mean you don't like giving talks in sweatpants?
No, well, they never say no to us. We're seeing our clients, and especially in Cambridge, starting to come back to work. Some of the things like they're trying to reduce the number of people in their space. So shift work is becoming the thing. 7 to 1, 1 to 7. Sometimes they're operating 7 days a week. Is one way that they're trying to still create that collaborative experience. As I mentioned, you know, one of the interesting things is this idea of, you know, where the privacy line is drawn. OSHA has released new rules about tracing COVID infections back to an individual in your workplace. That is pretty intrusive, and people would object to it. Certainly the health, the HIPAA rules of privacy are being tested in all this process. But you know, we're seeing more and more. Jeff was referring that if there's good PPE in place and good social hygiene, the infection rate is almost zero. And I think Jeff could talk to the fact that at Beth Israel, and I'll let him, the statistics of infections are almost zero as a result. So with the proper roles, responsibilities, process, PPE, it can be managed, and so people can interact. Jeff?
Yeah, I mean, I think we're going to see, spaces are going to need to be, more, at least temporarily for the time being, they're going to need to be more open. I think signage, wayfinding, branding specifically that supports this, what I call the new social contract, or what Nancy was saying, we're all lifeguards, will play an important role in making all of these spaces safe and collaborative. The more and more I dig into this for our clients, the more, I'm convinced that it's just wear your mask, wash your hands, clean your surfaces, stay 6 feet away, and make sure that everybody around you is doing the exact same thing. We do have to be responsible for other people's well-being.
Yeah.
As well as our own.
What did Beth Israel find out about that?
They were their infectious disease head was certainly concerned about, patients that were coming in on an emergency basis that didn't have COVID-19, whether they were being infected or not. So they were keeping track of this, while at the same time they were keeping track of employees coming and going. I mean, there's almost 75,000 people in that network, people moving in and out all day long, 24 hours a day. And they had a less than 1% infection rate for the employees and non-COVID patients that were coming in on an emergency basis. And they are 100% convinced that it was because they all wore their PPE religiously, and they all were honest about whether or not they had symptoms before coming in to the office or coming into the hospital. So they were the ones that basically said, we really have to pay attention to this, if we're going to come back, this is the way to do it. Is just be open, honest about your own personal health, and then take responsibility to wear all of your PPE, not for you, but for everybody else.
Robert or Anthony, do either of you want to add anything to that?
Yeah, I'll throw in, recently my company was, surveying, what they think about working remotely at this point and what they miss most about being back in the office. And, the big response was they missed those random interactions I mentioned before, the social gatherings. So we tried testing out this virtual hangout tool. Everyone goes on this, web-based tool. They randomly bump into each other. It's awkward. It's not fun. I'll tell you, like, the social experience was not there. I got the intent, but we're definitely not going to get there virtually speaking. And, just to the point of many people on this panel already, I think we're just going to have to look to see what measures we can implement to really get back to that social interaction. I think it's really important to how we collaborate and how we work.
Yeah.
I don't think there's a virtual tool that exists yet that's going to get us there.
Yeah. Just to change gears a little bit, will there be, this is a very interesting question, I think. Does anybody believe there could be a shift to more suburban environments as a result of workers, staff, researchers not not relishing mass transit the way they perhaps had to in the past?
I mean, I think that's an excellent point, Kevin. I think that, people are fearful, as much as they want to get back to work, they are fearful to come back to work.
Yep.
I've had clients with multi-generations in the house who, elderly parents who are living with them just cannot afford to bring it back with them. And right now, rightly or wrong, people see mass transit as being a higher infection site than perhaps their own workspace.
Yeah.
I would think that, just less expensive, if we're inviting more automation, if we're inviting more technology into the space, it's going to require bigger buildings. And then obviously space is a premium in places like in the city, and you could move out here. There's still mass transit, and there's, driverless cars someday that will take us back and forth, right? So, but it's not all technology. I think that I wanted to follow up on the other point that you made. The education and communication with employees to explain where they are in their workspace is going to be absolutely critical. And that's when, you will start to get people excited about coming back to work and having those collaborations and interactions.
I see, Kevin, I see temporarily that people will maybe migrate to the suburbs. We're already starting to see it. We have a number of requests from clients to analyze a second satellite office in the suburbs. We have a number of consultants who have offices in the city and offices in the suburbs, and the requests from their employees to go to their suburban offices versus their urban offices are significantly higher than normal. Kind of the opposite of what was happening before this. But yesterday I was actually coming back from my office and was listening to the radio, and there was an interesting poll on WBZ, the news radio here, and they I was shocked by this number. I thought it would have been higher. They said 38% of the people that take mass transit would reconsider taking mass transit. So that means that more than half the people are going to go back to taking mass transit. And I thought that was low. I would have thought if you had asked me, I would have thought that number would have been 75% of the people won't reconsider taking mass transit.
Yeah.
So I do think the Boston Cambridge market is very different than the New York market relative to mass transit, and the percentages of people that take it are significantly higher. I would love to see what that poll is in the boroughs. I would think that I would expect that number to be higher. But I'm hopeful that it's not 75%, because I think that people can see a way out of this. But I think that temporarily there's going to be a little bit of a flight, but I don't know how long it will last, because the other part of it is I think there's a significant part of the working population that can't afford to go to the suburbs. There's a lot of our staff, a lot of the life science staff here, and a lot of life science staff and staff in general in the New York City area live in the city.
Yeah.
and they don't have cars, and they live in the city and don't have cars for a reason. They enjoy that.
I mean, Nancy, you're developing these sorts of environments and have done for much of your career. You must have some thoughts on whether this is going to, whether the balance is going to tip.
Yeah, interesting. You know, I mean, I think it's going to take some time for things to shake out and for people to feel comfortable again. But I think once that, you know, the proper procedures are put in place, people can feel more comfortable that they're going to be safe. I don't think there's any question that people want to be in urban environments, you know, around good restaurants and fun things to do, and be able to meet up, you know, with each other after work for drinks, and just be able to do that easily, and not have to get in a car and drive like you do in the suburbs. I don't think that's going away.
Yeah. Yeah. Let's talk about social responsibility, and I'm going to hand it back to Nancy. And we've got some live questions coming in, so thanks to the audience. Please keep them coming. We'll get to those in just a few minutes. What role do you think social responsibility will play in the transition? For example, can you require people to report if they're sick or not? Who would like to take that?
I can take that.
Go ahead.
You can't. You can ask them questions about their symptoms.
Yeah.
And you're within the the EEOC, Equal Employment Opportunity Commission's guidelines to be able to ask those. And then if they reply with symptoms that are similar to COVID, you can give them advice to go home and stay home. And you can require them to stay home, especially if it poses a problem for their own safety or other coworkers' safety. So this is literally on the EEOC's website of what you can and cannot do, because it's not considered a disability-related action. You can't tell the whole world why that person isn't coming to work. Those still fall under the HIPAA regulations, but you can in fact and are actually encouraged from CDC guidelines to ask simple symptomatic questions. You can't come right out and say, hey, do you have COVID-19? But you can ask for the symptoms.
Okay. Any other comments?
Interesting. We've got a comment from Denise Aronson here from Safety Partners. And she says, we tend to overdo human nature and get stuck in ruts. Before COVID, too many coffees, too much emphasis to have to bump into each other for collaboration to be successful, labs with an abundance of living rooms. And now in COVID, too much Zoom. We are Zooming way too many things. So maybe this time of reflection will allow us to have a much better balance.
I tend to agree with that. I mean, I think we probably overreacted to collaborative space and maybe underreacted to personal space. There's somewhere in the middle, I think, that works.
Yeah, that's interesting. Getting that balance right.
Yeah.
What about, final question from me, what about monitoring versus privacy? How do you think contact tracing will affect employees' relationships?
The New York Times did a bunch of articles on this. I think it was Friday, and it was interesting that we're seeing a lot of information about the antibody and is the antibody good or bad. And there were a nurse actually that was had a shirt on that said I had COVID, I'm safe, and she noticed that none of her neighbors would talk to her. So I mean, I just think human nature is is going to be to avoid those folks. And until, honestly, I look towards our government and our agencies to give us better advice on this. I think until it stops being a political conversation and just starts being a medical fact-based conversation, there's going to be a lot to be learned about human relationships from this.
Kevin, I would also add on to this,
Sure.
the safety protocols, you know, they're a little bit, you have to be very diligent with them throughout the day. And I was at a construction site last week and everyone started off the day great. We had our masks on, we had our separation. Halfway through the day, you know, the masks are falling off to the side of the face, people are getting closer, and we had to, you know, have a gut check in terms of what we were doing. So it's going to be really taxing over time, I think, to people and how we get back to the workplace for sure.
Yeah. Yeah. Very good. Nancy, we've got a handful of questions that have come in the chat box, but you may have others first, and then we can go through the audience questions.
Yeah, no, why don't we jump right into the audience questions?
Okay. You want me to start? Okay, Steve asks, how cognizant are the clients about the costs associated with these changes, including not just capital requirements, but increased operating costs, such as higher energy usage for increased fresh air for ventilation? Have these elements been part of the discussion thus far?
I'll chime in on that. When it
Yeah.
started, they had absolutely no clue. They knew what the end product had to be, and we brought them along with our MEPs and with their in-house facilities people on, here's the impact on dollars, but look at what you're saving long-term, long run. So it does become part of the conversation, but you don't have a lot of options.
Okay.
So yes, they are made aware of it. Eventually, it has to go back to the financial departments.
Yeah.
I'll add on to that too, Kevin.
Please.
So NYSERDA came out with a new program that they're looking at to try to understand the impacts of all these building enhancements to try to combat, you know, the virus transmission within office spaces. So that program's out there right now that we're looking into, you know, because the things we're talking about, removing more particulates from airstream, increasing filter efficiency, that adds fan energy. More ventilation air, that's more cooling and heating plant capacity. You know, all of these things really go against where we're headed in terms of reducing energy and reducing carbon for our building. So I think there has to be a nice, you know, marriage between the both of them, that we have to address the health and wellness, but we have to keep in mind, we can't forget about where we're headed in terms of energy consumption.
Yeah.
I would add to that, our clients haven't really, the ones that I'm working with haven't really said, how much is this going to cost me in my first cost? What they've been more concerned about is their relationship to their sustainability practices and how all of this is going to affect their sustainability practices going forward.
Okay, great. Next question. I'll carry on, Nancy, until you tell me to shut up. Some hospitals, this is from Silka, I think. Some hospitals are employing now security guards, reminding doctors, nurses, and staff and patients to put on their masks. They're even making sure that PPE sits correctly. If this is a more neutral person, not a coworker, it would even help to develop better cultural change. I wonder if this would be a valuable new employee we should all be hiring.
I can take that one, Kevin.
Yeah.
We actually do this. We call them safety ambassadors.
Oh, yeah?
Right? Even down, we'll push the elevator button for you so you don't have to touch it, right?
Ah.
And helping people with their PPE. As I said, more and more clients are looking toward the idea of creating that occupational health role within their HR department. Sort of like the school nurse, when you've had a tough day, you go talk to her. And so that she is a neutral person, as I think most people would see their HR person or HR department as being part of that. So the OC Health to manage temperatures, confidential information is a role that I think we're going to see more of, and has the HR rather than sort of a passive response, but be more proactive in these kind of roles. And yes, security guards probably seem a little heavy-handed, but they typically know everybody. They typically are there all the time, and so they probably have a good good idea of who will fall off and who will do it correctly.
Are you talking about just in hospitals or a broader range?
We've done it in labs. We've done it for clients, not just hospitals, but in fact, that safety ambassador can, oh, you forgot your mask. Here's one right here, right? You know, or you need gloves, or it's that role that we see. You know, years ago in manufacturing sites, you had a nursing or a nurse on site. That has largely been eliminated. I suspect it's not a full-time nurse, but an occupational health person is going to start to be that person going forward.
Safety success, I guess you could call it.
Yes.
Anyone else have a comment on that? I'm hearing no takers, so we'll move on to Yasmin, who asks, how would you respond to employees who don't want to wear masks, PPE, etc.?
Mandatory.
Mandatory.
Got to go home then.
Yep.
I mean, you could dig a little bit and understand why, if they feel constrained, if it's a fear factor. But I guess it's not a question of the mask. It's usually a question of, I don't want to be here kind of question.
All right.
We sort of said it as if, look, if you want to come back to the office, then these are the rules you've got to comply with, and it's a compromise. But you don't have to come back to the office. You can work at home if you don't want to do these things.
Yeah. Yeah. Duncan
Some of these
asked, I'm sorry, go ahead.
Some of these are or city and state mandated. It's not a question of an employee policy. In Massachusetts, Boston, you are required to wear a mask in the office.
Yeah.
But I do think that question raises an important point, and that is that people have different levels of comfort with risk, and they also have different ideas about personal freedom and rights. And this is going to, I think, kind of call both of those things into question. I know, I'm working in Tribeca right now in Lower Manhattan in a building where lots of people are working from home. And I would say that lots of people have different ideas about whether they want to ride in an elevator with another person, whether they're going to put a mask on when they're going into the elevator, whether they'll even come out of their apartment to take a walk, and I've just noticed that there are lots of different opinions and behaviors in the building. And I think you're going to see that in the workplace as well.
Yeah, yeah. We've got a flurry of questions, so I'm going to keep moving along. Duncan wants to know from all of you, how many feel we're going to have a second wave of COVID-19 in Boston? I guess this could apply to other cities as well, in the coming fall, winter season. And what concerns you the most should a second wave happen?
Yeah, I couldn't answer that question.
That's great. I don't think I qualify as a public health expert.
That's
I can cheat and say what I've heard from our clients who are
Go ahead. Yeah, sure.
clients. It's coming. We're not quite sure when, and we're not quite sure how bad, but it is coming.
Yeah.
And the biggest concern really is the economy at this point, right? We need to start recovering. If we hit another downturn, we don't know what's going to happen.
Yeah.
Rents are getting killed in the city in terms of, people trying to pay rent for their office spaces. The retail spaces are getting killed. So it's not a good situation right now.
Okay. RJ asks, do you feel there's a balance with implementing systems that increase energy usage versus implementing policies and procedures that can be lifted gradually as the risk decreases?
So
Go ahead.
Go ahead, Jim. You got it.
Well, Nancy brought up a great article by Alan and Mac Homer that talk about the levels of controls in a building. Obviously, some are more expensive, but they have a better impact. So it is that balance, and I would refer you to that article. It talks about keeping everybody at home, which is the safest thing to do, but it's not very effective. At the top end, wearing PPE allows people to integrate. But again, the effectiveness is lower than staying at home. And you talk about administrative engineering, substitution of activities. I think it's actually a great visual that people could use to, if I do a little bit from each column, maybe I can have success in managing the space. Doesn't have to be all one thing.
Okay. Anybody else?
I think that, we're not just talking about COVID-19 here. We're living in a world where there is going to be an increasing number of infectious diseases that are going to be influencing countries in the workplace. And so even if COVID-19, if there's a vaccine that's found or treatments, doesn't necessarily mean that we're going to be able to move away from these safety measures.
I totally agree with you, Nancy. I think in the past, we looked at health and wellness to some degree as an elective thing. It's nice to have it in some cases. Well standard was something that people elected to do for their building designs. At this point, we know too much about what's being circulated within our airstreams, what exists on surfaces. And I think health and wellness is going to be one of the primary things moving forward with all of our designs. I don't think it goes away. You may see some stuff get relaxed to some degree to reduce some of that energy we talked about before. but I think you're still going to have to look at the health and wellness aspect and make sure we have those measures in place.
I mean, I also think that there's, you know, we're sort of balancing sustainability, we're balancing health and wellness, we're balancing all of these, these sorts of things. And I think that because all these things have all started to, they come together all of a sudden where they hadn't in the past, where you could decide whether you wanted to do health and wellness, you could decide whether you wanted to be sustainable or not. And I think that as a result of these all coming together, as a result of this pandemic, let's look at the bright side. We might get something good out of this in the end, and that is people will start to pay a lot more attention, certainly manufacturers of equipment, certainly us as in the design fields will start to pay a lot more attention to these things. And we will start to get creative, and we will start to get innovative, and we will start to solve some of these problems that we can solve. I mean, none of us are going to, at least I'm not going to invent a medical solution for this, but we could be very creative about how to solve these problems in the future and using a little bit of everything to get to the best solution. I feel 100% confident that that's going to happen. It's already started to happen.
Okay.
And it'll fix itself, I think. That piece.
Great. I've got a good question here from Priya that I think will impact everybody's organization. Do you see any employers asking those employees that are high risk or have high risk family members at home having different requirements of coming back to their labs or offices? Is it one size fits all, or will there be some flexibility? Should there be some flexibility?
I think it'll be flexible.
Okay.
I think it has to be flexible.
Okay.
I would agree. I think that, again, if in fact people see their employees, their researchers as being the secret sauce, people will try to make accommodations. I'm looking at the next question about masks and asthma. You could always consider a face shield that goes around the neck or the top that doesn't constrict airflow. It just is more visual. I'm not sure if it's as effective, but now you're getting into accommodations on the American with Disabilities Act. That will probably evolve as a result of this as well.
Yeah. Sean has a great question. With everything that needs to be considered in design going forward, who else needs to be sitting at the design table? Who owns this issue within the organization?
Human resources.
Bob.
Bob?
An individual lab designer.
Bob Mitchell.
Bob Mitchell. We never get a chance to talk to environmental health and safety till we're already halfway through the design or in construction documents.
Yeah.
I see those people coming in on day one on helping us. How are we going to do this? How are you taking care of these labs or healthcare spaces right now? It's a very interesting way to look at it. Same thing with maintenance. Never talk to building maintenance till we're almost done with construction documents, or we'll get the book of standards. I see them coming in very, very early. Also, the people that may be involved in selecting robots say, oh, we need this and that. The door now has to be a 40-inch door instead of 36-inch. I see a lot more interactive with security and everybody else very, very early on in design, instead of when it would normally fall at the end of design development or in construction documents.
Jay, we were talking about airflow in the first half of the program, and James wants to follow up on that topic. So I think this is relevant. Because of some successes of underfloor air distribution in general offices for better indoor air quality, is a UFAD system a viable way to reduce particles in the working environment?
So I'll take that one. What we've been looking at in my office, and we're actually testing it through CFD modeling, is actually reversing it, using that raised floor for return air and pulling all those large droplets down to the floor where they naturally are falling. So you would supply over the top of the occupants, and then pull all those contaminants down towards the floor. Of course, to retrofit that in an existing building, it's really not possible in many cases.
Yeah.
But new buildings moving forward, that may be what we're looking at. And I mentioned it before, but the hospital design, it's something very similar. Supply high, return low. It's a simple strategy. It's been used for decades.
So it's not just a theoretical premise. That's actually been shown to work in some situations?
Absolutely.
Okay, great. Jerry wanted to know a little bit on a tangent here, but the stimulus payments of an additional $600 a week seem to have disincentivized some people from returning to work. Essentially, the thinking is, why put myself and my family at risk when I can stay home and collect? Has anyone found this difficult to retain entry-level and support staff because of these payments?
Yes. I think between state unemployment and the federal government $600 a week, it is people who are typically making minimum wage, $15 to $20 an hour. They'll be making more on unemployment. I don't know if it's a risk issue. It's simply the fact that they are making more money staying at home, and they are probably off doing something to earn extra money, whether it's mowing lawns or tending bar or something like that. My understanding is the federal program runs out in July, so maybe we'll start to see people start to filter back in with a little bit more energy at that point.
Well, the last comment we have is from Joe, who says that today, just a helpful public information service announcement today, the governor of New York signed an executive order that businesses can deny entry to anyone not wearing a mask or face covering. So thank you for that. And that's the last of our audience questions, at least for the time being. So Nancy, I'm going to pass it back to you.
Yeah, so this has been a wonderful discussion. Thank you, everybody, for participating. Just go around quickly. Does anyone have kind of some last recommendations for, CEOs of life science facilities or tenants or buildings as they're looking to bring their workforce back?
We covered a lot. I mean, I don't know if we want to outline it, send a simpler outline.
I'll throw one idea out there. There's no silver bullet here, and every life science space is different. So you can't really transpose enhancements from one building to the next potentially. So I think it's really critical you go through an extensive survey and study to understand what you should be doing for your building type and your layouts and your HVAC system to see what you should be doing.
I think that the smart CEOs that we're working with have put together a task force that represents not only the engineering facilities, but the HR, communications, so that people feel comfortable coming back to work and have resources to lean on as they do so.
Yeah.
Yeah, and planning, just sort of good planning. Don't forget to absolutely consider how it might actually function at the end of the day.
Robert, any parting comments?
I can we have a small firm. It's a 10-person firm. We have 3 people that are immune compromised and are working out of their houses. We've more or less come back to work. A lot of these questions have come up just amongst ourselves and talk, and we've worked it out on a one-on-one basis.
Yeah.
So that everybody is still working. Nobody's interested in not coming back. We have somebody who may be working out of his house for the next 6 months until there's vaccines all around, and we're making it work. It's not easy, but we're figuring out how to make it work.
Mm-hmm. Okay, well, great. I guess that's a great note to end on. We'll figure out how to make it work. So thanks everyone for participating. Thanks to SGA for hosting the seminar. Have a great day, everybody.
Thank you.
Thank you very much.
Thank you.
Bye.
Bye, everyone.